Anyway, this is the issue. It's a reality.
District local leadership of Ntungamo has been accused of being weakened and compromised to effectively monitor health service delivery and confidently take rightful actions. This comes during the evaluation meeting of the district leaders and health workers in the district with the State House Health Monitoring Unit that was yesterday held at Ntungamo District Headquarters after the unit spent close to 3 months in the district and registered high cases of health workers absconding from duty, misuse of government resources, and abuse of office, among others.
The cow is held at ransom. The DHO is held at ransom. The in-charges are held at ransom. Everybody knows the president. Everybody knows Mama. Everybody is a general Sabimbi.
According to the Deputy Director of the State Health Health Monitoring Unit, Julia Nabatanzi, most of the district leaders and health workers in Ntungamo district have been hiding behind having a connection to the first family of Uganda to politically interfere and intimidate the health service delivery in the district. She adds that the Rewards and Sanctions Committee has over 20 incorporate cases of indisciplined files for health workers that have not been dealt with in the district.
The district leadership is weakened or compromised. We find that they are not confident to take the actions they need to take. And we are hearing a lot of political interference and intimidation. As we know, the first family, this is their origin, so people hide in that. To abscond from duty, to abuse office, to misuse resources, and to do all manner of unacceptable things. If you're not disciplining, as we know, the Rewards and Sanction Committee has many incomplete cases, over maybe 20 files of health workers they haven't dealt with in disciplinary, and these health workers are not in facilities. We do not know where they are, and that leaves a very big gap, but they are being paid a salary.
Nabatas adds on saying that during their monitoring tour, health workers in Ntungamo district recorded frequent absenteeism, as most of the health centers in charge own private clinics. They give much of their time over the government facility. She adds saying that this has hindered service delivery, noting an incident of the maternal death that happened on October 7th at Itosha Hospital because the medical officer was absent.
We had a maternal death that happened in October 7th in Itosha Hospital because the medical officer was absent. And so the lady was attended too late and she died in theatre because of delay to perform the emergency cesarean section. And we find that most of these medical officers have private clinics where they spend time. We have visited them and we have found them in their facilities when they are scheduled on duty in hospitals. So I think a time has to come when the medical officers decide where they want to be, because their absenteeism is leading to death of life or to loss of life, and that is too high a price for them. The district.
The resident commissioner for Ntungamo district, Geoffrey Mchugzi, forced to use his office to deal with the corrupt leaders, especially the health workers in the district, after records indicate that they have been cheating on the patients. Mchugzi says that the operation will continue even when the State House Health Monitoring Unit will be out of the district.
I want to be clear. The president recently told us that DCs who cannot fight corruption, that they should go back home. And I'm not among those. I want to stay here for something. Since I'm not ready to go, be sure we shall arrest every criminal. If you are not, simply come to the team, introduce yourself, address the issues. The intervention is normal. If you are culpable, they will handle you. If you are not, you will go back to office. But running away implies that, first of all, you are already guilty.
The Chief Administrative Officer for Ntungamo District, Nasa Muchibi, says that the district has about 4 health centers that have to upgrade their status, adding that these will need more staff, saying that the Human Resource Officer is working closely with the District Health Officer so as to have more staffing by the end of this financial year.
Lack of some staff we need most at health center to make it a complete unit for delivering what we call comprehensive obstetric emergency neonatal care services. We have done well in recruiting the doctors. They are there, but we lack anesthetic officers, and it could be the reason why you hear some of the public outcries and complaints about functionality, especially when it comes to operations.
We also have new health facilities that are almost getting completed. We have Ruoho, we have Buhenama, We have Keina, Kafunjo Miram. They have been upgraded and now they need new staff. My HR team is working closely with JHO's team, and I believe before the end of this financial year we shall be able to recruit and deploy staff that suit the level of those health facilities that have been upgraded.
A team from the State House Health Monitoring Unit spent about 3 months in Ntungamo district investigating service delivery, though more than 3 billion monies were acquizzed as a result of misuse of government resources, absenteeism the leading case in the district, ghost workers, long paid allowances among others. Ntungamo for Portuguese Television.